I apologize to Mark Haddon. I miswrote the name of his title. Can you all hear me? I have the mic going. Okay. It's been a while since I've done sort of the technology of a presentation. I want to welcome you all. It's nice to see some friendly faces in the audience. And I'm so pleased that people are interested in this topic. It is becoming a significant topic that we hear a lot more about, and I'm glad that you are interested in learning more. Tonight, what I want to do is sort of speak to the general definition of what autism is, how it's diagnosed, some causes of it, symptoms of it, and treatment. And I have included some videos in here that I hope we can use technology for everybody to appreciate them. I'm sorry if it doesn't work, but we'll do our best. And I will leave time for questions so we could talk about it. My guess is that some of the folks here are here because they have somebody with autism in their life, and certainly I am an expert on the medical science of autism, but not on the experience of living day to day with autism, and so would invite a deeper conversation with folks if you're interested in having that. So what is autism spectrum disorder? So it is a neurodevelopmental syndrome, and there are three areas of deficit identified. So social, emotional, communication, and then unusual, restricted, or repetitive behaviors. And we're going to go through each of those and talk more in depth, but that is the sort of nutshell of what it is. And one definition term that I think is pretty helpful when we're talking about kids or people with autism, we talk about it being a neurodevelopmental syndrome. And when we're talking about kids who do not have autism, we often talk about neurotypical rather than just saying normal. We're trying to sort of expand the differences and not denigrate one or the other. So we are living in sort of an interesting time. Just recently in psychiatry, we went from a diagnostic criteria that separated autism, Asperger's, childhood disintegrative disorder, and then pervasive developmental disorder. And there has been a significant amount of research in accurate diagnosis and constellation of symptoms, and a pretty heavy-hitting committee of autism researchers have put forth a new diagnosis in what's called DSM-5. So it's the Diagnostic and Statistical Manual. It's how psychiatrists and psychologists and other therapists diagnose things. And now all of these four criteria there are all part of autism spectrum disorder. And when it came out, there was a lot of hubbub. You probably even heard, like on CNN, some little blurb about this. And the concern was not for people who were diagnosed with autism per se, but more for people who were diagnosed with Asperger's or pervasive developmental disorder, that they would somehow fall outside of the diagnostic criteria and no longer get services. And fortunately, this did not happen. And I actually have not heard from any colleagues any cases of kids who were undiagnosed autism. If you had one, you kept one, sort of no matter what. But it's a little bit of a cleaner way of understanding it. So I want to go through the different symptom domains, and we're going to go each one of these sort of separately. It's important to say that everybody, neurotypical, kids with neurodevelopmental disorders, has some of these things. And so the trick is if you have a group of them from each together. And so I'm sure we can all think of somebody, as I go through the list, who sort of has something there, and you're like, oh, do they have autism? No, not unless they sort of have something from each of these. So let's talk about social emotional differences. So one of the kind of cardinal things is that kids and adults with autism can be lacking in social reciprocity. This means the sort of give and take of social interactions. And they have a decreased joint attention. And this is very important, and we evaluate this actually in pediatrics a lot. If a baby is sitting on your lap and you as the parent point something out, the baby will turn their gaze to that item and look at it and then look at the parent's face. And that is an experience of joint attention, where you are gazing together at something and then experiencing it together. That is frequently missing with kids with autism. Poor eye contact, I think everybody has heard about this. And, you know, it varies. I've actually had kids who are my patients tell me that it hurts to make direct eye contact. And that discomfort is so much that it's an aversive experience. There's also some research about gazing at the wrong part of the face. So kids with autism, adults with autism, often will gaze more at the mouth while in conversation than neurotypical folks who tend to gaze more in the eye area. And the thought is actually that because they're gazing not in the sort of correct place, it decreases their ability to understand the emotional message that's coming with the words. Because a lot of times, you know, we can fake a smile, but our eyes don't fake one. And so they're missing that part. Additionally, and I don't have these listed, but I think they're sort of important ones. Early on, kids, one of the sort of cardinal signs is a lack of pointing in very young children, so toddlers or even before. If kids are pointing at stuff, that means they're wanting other people to look at those things, and they understand that concept even if they don't have words to describe it. So if there's a child that is not pointing, that certainly warrants more investigation. There's also a descriptor of, does your baby feel like a sack of potatoes? Does it sort of lie there in a lump and not mold to you or cuddle? And does it have this sort of discomfort with that connection? And that certainly can happen, as can a baby being too good, too quiet, not complaining, not asking for what it wants. That could be an indicator of a developmental problem. As they get older, you notice a difficulty with social nuance, not seeking out comfort from others, whether it's from parents, other adults, other kids. A significant struggle with using the theory of mind, which is thinking what somebody else might be thinking. So I can imagine what you all are thinking reading this, and you can imagine what I might be thinking standing here at this podium in front of you. But that feature is missing. They can often do very good thinking, just not thinking from the perspective of somebody else. And then empathy and interest in other people's emotion. It tends to not be a highlight. And you know, this isn't everybody. Again, there are kids who are really sort of more tuned in to how like animals feel, and there is a sense of empathy with that, but it's just across sort of the population, it's less likely to be there. In terms of communication deficits, it's very common to have language delays, and that can be a diagnostic criteria. Kids speak late or don't speak at all for a long time and require speech therapy. When they do speak, sometimes there's an odd use of language. One of the greatest examples I was ever given is a child who described a shower as hot rain. And we know what that is. It makes total sense, but it's a very odd use of those words together. Kids also do a lot of reciting from movies or TV, but without understanding the content or the context. It's just sort of verbatim and used in a way that can be ritualized, can be incredibly annoying, can be, you know, sort of amazing. There's a lot with it. And then in terms of researchers looking at the use of language, they found a significant decrease in frequency of the use of speech in kids with autism compared to neurotypical kids. In terms of the rules of conversation that are unspoken, but I think most people understand, there's turn taking, there is not interrupting, there is a back and forth in terms of content. That can be very, very challenging for kids with autism, and adapting their conversation to their audience. So they might be able to give an excellent presentation on the Titanic, but then when they're talking to a peer in the playground, they keep giving a presentation on the Titanic and the peer has no interest in that. And it's hard for them to even read that. And then difficulties with non-explicit or ambiguous communication. So making inference, using idioms, using metaphor. And for those of you who've read the book, actually, there's some really nice examples of that with metaphor and idioms and how the main character really struggles with what that means. So the last sort of domain of symptoms is the unusual, restricted, or repetitive interests. Kids who play with toys in sort of odd ways. And, you know, this could be a lot of kids, but there's sort of a persistentness to it. So an example might be a child who lays on the floor and has a car and just spins the wheel and watches the wheel only. You know, this is almost hard to describe, but when you see it, you sort of know it because they can be just such a different way of understanding toy. And sometimes it's looking at just the parts of toys, kids not understanding the whole of a toy. There is also, for some kids, a really singular focus, and the intensity of it is beyond what you would expect. And the range is sort of as I listed. It could be Elvis Presley, it could be trains, the Civil War, train schedules. It's hard to know what's going to grab kids' attention, but when it does, for some kids with autism, they just can't let it go. It is the thing for them. And they will know everything about it usually, way beyond anything that most of the general public knows. Frequently you'll find different kinds of movements. Often these movements serve a purpose for calming or decreasing stimuli or increasing stimuli. It's hard to know. Every kid's a little bit different. But there are noticeable differences in movements compared to neurotypical kids. And like spinning might happen for 20 minutes during recess, every day. I mean, it's sort of a very repetitive behavior. Inflexible routines and rituals. A lot of kids require things to be exactly the same, and that you drive to school exactly the same way, that lunch is exactly the same, that the bedtime ritual looks exactly the same, and any disruption to that can really be hard for kids and can throw them into significant distress. And that sort of moves on to sort of transition. So transitioning between activities, going from home to the car to school, school back to the school bus, school home, all of those transitions, and even mini transitions, going from watching TV to dinner. That can be really challenging, and takes a lot of work for families to help kids with that. Some other sort of sensory things, kids can be hypo, which meaning sort of not sensitive at all, beyond what you'd think, or hyper, much more sensitive. So pain is a frequent one. Kids can have really horrible things happen to them and they have no pain complaints. And as you might imagine, in terms of the medical care for those kids, this is concerning. Temperature tolerance, certainly heat or cold can be a dangerous thing for these kids. Sensitivity to smells is frequently present for kids. I have a patient who was having meltdowns at lunchtime at school every day, and it turns out that it was because of the smell from the cafeteria. And once we were able to figure that out, actually they had very smooth lunches, and it didn't involve going to the cafeteria. There can be fascination with lights or spinning objects. Kids will often look at things at the corner of their eyes or watch things spin intensively. And you know, a lot of people believe that that is about a stimulation response. Some kids really like the feel of compression or pressure, and these days people are using things like weighted vests, weighted blankets, other ways to help them have that feeling and relax. There can be a lot of sensitivity to noise, and certainly in the book there is a scene in a subway station that really sort of is very evocative of the noise issue, and then difficulty with multiple stimuli. So there is some difficulty with prioritizing what stimuli to pay attention to. So our brains are pretty good at tuning out, you know, there's an air conditioner going out there, there's a little bit of light coming in here, there's some movement over there, there's some movement in the audience, and we still are sort of sticking with what we've decided is important to attend to. Kids with autism often have difficulty, and everything goes in, and then they can get really overwhelmed. So understanding how to limit stimuli for these kids and why familiar things feel a lot safer for them, you know, that would be one of the reasons. So why is it called spectrum, an autism spectrum disorder? One of the reasons I think that people say that is just there is this continuum of symptom presentation, and then there's also a range of functionality. And I am going to try to show you guys a video that's a little painful, actually, and I'm going to ask you to stick with it because it is only a few minutes of our life, but this is this mother's life every day, and I think it's pretty evocative. I'm going to try to get the mic so you can hear it. Although she has written some things, and I got permission to use this.
So one of our challenges right now is getting Allison dressed every morning. Some have said to let her pick out her clothes, but she has such a low cognitive ability, she doesn't understand this yet. Once she has her clothes on, I reward her with her favorite cookies. She leaves her clothes on for a few hours without a problem, it's just the dressing that's the issue. Tips, strategies, they're very welcome. Here's 4 minutes of me trying to get just her shirt on. Oh, and please excuse the messy room. It was quite early in the morning. Okay, we're just gonna wear a shirt. Okay? Nice shirt. And when I count to 3, count with me. 1, 1. Well, we're going to try again. Ready? No more bite your arm. Look, it hurt. Okay? No more bite your arm. I help you. You have to wear clothes. First of all, wear clothes. Okay? I help you. For school, we wear clothes every day. I help you. Okay? It's Friday. Tomorrow. Okay, ready? Okay. It's just a shirt, Allison. It's just a shirt. No bite. It's just a shirt. Good job! Good job, my baby girl. I said good job. See, that's not bad. Look how beautiful it was with the shirt. No okay? No
So kind of painful to watch that, isn't it? So imagine if you had to do that every day with your child. I'm very moved by how patient she is because I think it's hard to do. So she actually has another video that I'm going to show you if you can tolerate. This one's less distressing, but still is very evocative.
Go inside. Go inside. Go inside. Inside. Come on. Inside. Wait. We have to go inside. Allison. Inside. It's cold out here. Allison. Allison. Come on, Allison. Come on, Allison. Up, up, up. Come on, Allison. Up, up, up. Inside. Inside, Allison. You're gonna get sick. It's cold. Really sick. Come on. Go inside. Come on. Let's go inside. Go inside. Go inside. Come on. Come on. Come on, Allison. Up, up, up. Up, up, up. Allison.
So it's hard to know why that was hard for Allison, but it sounds like it's hard for her regularly. So kids with autism have a lot of co-occurring disorders and medical concerns. Intellectual disability is a big one. Not every child with autism has intellectual disabilities, and certainly not every child with intellectual disabilities has autism, but there's a high concordance rate. ADHD is frequently present, anxiety, OCD, although in psychiatric circles, sometimes it's hard to separate OCD from the kind of restrictive interests as a cardinal feature. So that one, we try to treat OCD, I would say, but seizures are very, very common with kids with autism, learning disabilities, tics and Tourette's, gastrointestinal problems, and a range of them: constipation, diarrhea, stomach problems, and they can be really significant. And if you think of a child who is less good at communicating what's going on and has a high pain threshold, something like constipation could be a very serious problem. Sleep problems are a regular occurrence in general among autistic kids and adults, and then I see it a lot in my patients in particular. Sleeping through the night, waking up early, having difficulty initiating sleep. Nutrition problems can occur. Kids can become very particular about what they eat, whether it's about texture, color, things touching each other on the plate, and they limit their nutrition. And sometimes medications can create hypernutrition. Kids become ravenous and overeat. Dental problems can be significant, especially on nonverbal kids who have difficulty tolerating anything in their mouth. Motor tone frequently is a problem, and kids either have low tone or poor coordination. Fragile X and tuberous sclerosis are frequently present with autism. So in terms of epidemiology, the prevalence right now is 1 in 68 children. 10 years ago, it had been 1 in 88. More males than females, as you can see. And then the incidence is 30 to 60 per 10,000. The increase in prevalence over the last 10 years is, it's been a high level of attention in terms of the media, because nobody really knows why. I think that there are some really smart researchers who are thinking about this, and the sort of leading hypothesis is that we're doing a better job of diagnosing, that those kids have been there all along. But I don't think that's the only one. I think people are wondering if there are other things in our environment that are creating a higher prevalence. And we don't have all the answers at this point, and hopefully we will at some point. But it's definitely a concerning trend. So causes. Genetics have a big role in this, and siblings have a much higher risk for autism, but they're not the only role. There's also the thought that the environment has some role, whether it is in utero, post-delivery. There had been a very credible body of literature about vaccines causing it that was recently completely found to be false. The research was falsified that started that body of literature, and at this point there is absolutely no scientific evidence to support vaccines as being a cause of autism. And if you leave here today just remembering one thing, that would be the thing I want you to remember, because that is the one that has been the hardest for physicians and anybody involved with autism to sort of backpedal on, because that felt so plausible to people. There is absolutely a chronicity issue where kids get diagnosed around the time that they're getting certain vaccines. So it made sense. My kid was fine before and now not. But again, they have done really large population-based studies that have convincingly shown that vaccines are not a cause. So, so how do we diagnose autism? Often the first place that kids are noticed, well, they're noticed at home. I should have put that there. But in my profession, the first place they're noticed is in pediatric offices. Pediatricians do developmental screening at a regular rate. They start at 2, do 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, and 24 months. And a lot of pediatric offices are now using the MCHAT, which is the modified checklist for autism in toddlers, and it's used between 18 and 24 months. It's a validated instrument and has been helpful in, I think, finding more kids who need more developmental screening. It is not used diagnostically on its own. So you don't get a positive MCHAT and then you definitely have autism. You get a positive MCHAT and then it's time for more investigation. The ADOS and the ADI, stand for Autism Diagnostic Observation Schedule and Autism Diagnostic Interview. They are the gold standard for diagnosing autism. It involves clinical observation with tasks and then clinical interview, often with the child and then the parents, and it is a very in-depth instrument. During my residency training, we had a child psychiatrist who specialized in doing the ADOS and ADI, and I got to spend quite a bit of time with her, observing her do it. And the seriousness and the comprehensiveness of this goes way beyond what certainly I can do in an interview with a patient. And so for my patients, if there's any question, I ask to have an ADOS done. So a diagnostic interview exam, that's what I do. And I ask a lot of questions of families and children, and I observe behavior, but it's not in a structured interview in the same way that the ADOS is. And so although definitely there are kids I've diagnosed with autism and I feel really confident with that diagnosis, it is not as specific as the ADOS. So I think it's always good to talk about like specific people with autism. And my favorite is Temple Grandin. So if you haven't heard of Temple Grandin, even if you don't care about autism, she is a fascinating person. She is outspoken with regard to the management of cattle in particular, but I think she sort of does more agriculture as well. And she has changed the way in which cattle are slaughtered at the slaughterhouse to a more humane way. She has a PhD in agriculture, to some sort of like engineering in agriculture. I'm sure I'm not saying the exact right one, but and she very clearly has autism, and she writes about her experience with autism. And she has a lot of talks out there. I've seen her speak, and she's pretty amazing. And then there are some famous people who have identified with autism and say they have it. I can't vouch for them in the same way I can Temple Grandin, but Daryl Hannah, Dan Aykroyd, and Susan Boyle, who sang on, is it The Voice? Is that the? So, and I have another example of a child with autism because I want you to see the range. So let me get this. Sorry, we get the ticking. I didn't know how to cut it so that we didn't have to have the tick, tick, tick. Yep.
Child prodigies have long been a source of great fascination. We wonder, how could so much talent reside in such a young body? So much genius. In a moment, you'll meet Jake, a 13-year-old math and science prodigy who's confident he may one day challenge some of the established theories of physics. The source of that talent and that confidence comes from our most remarkable organ, the one we understand least, the brain. What is it about Jake Barnett that had him taking college courses at age 8 and getting A's, and by 12 doing paid scientific research?
The story will continue in a moment.
There are no commercials, don't worry.
And today, at age 13, an honors college sophomore lecturing the crowd at his university science symposium.
And do any of you guys want my resume at all?
The untied shoelaces reveal either your average teenager or the first telltale signs of the absent-minded professor, or both.
Let's look at these system of points.
Surrounded by researchers twice his age, Jake is presenting his summer physics research project on PT symmetric lattice systems.
This has implications in fiber optics, electromagnetic signals, anything that requires like a light going through a cable. Got it? Every number or math problem I ever hear, I have permanently remembered.
You just never forget. They never
never
slip
forget.
out the back door of your brain.
No.
Is it fun for you to do it? I mean, do you get a kick out of it?
Yeah.
For Jake, fun is reciting from memory the infinite series of numbers known as pi.
3.141592653589793238462643383279502.
Jake memorized more than 200 of pi's numbers in an afternoon. And he did it just to test himself.
You want me to go backwards from there?
Well, sure.
32397985356295141.3.
Bravo. He's not just parroting a textbook. He understands and analyzes the logic of higher mathematics. He can visualize and solve complex problems by using what he calls the fourth dimension. Just exactly what is the fourth dimension?
It's hard to describe in terms of the typical three because it's tangent to all the other ones. I'd be able to describe it if I had like a whiteboard and like 30 minutes to describe it. It takes a while. It's the fourth dimension. What do you expect?
The numbers appear to him as shapes that he says just build on one another.
So this, for example, is 3 cubed or 27. And then if I want to do 54, I just stack another one onto it.
He says his mind is constantly buzzing with new physics problems and theories. When he runs out of wall space, he moves on to windows. Remembering things so precisely, does that ever become a burden to you?
No, not at all.
No sense of overload?
I remember math and numbers. I don't remember other things. For example, if someone asks me where something is in the house, I tell them I don't know.
The oldest of 4 kids, Jake lives with his family in the suburbs of Indianapolis.
These are my periodic table. It's got all my elements.
He used the money he made from his summer research project, $3,200, to turn his bedroom into a science lab.
Copernicus was the most recently named element.
For as long as he can remember, he's been fascinated by the mysteries of space.
Saturn is my favorite planet, not due to the rings, but due to some of its moons.
Any ambition to be an astronaut?
Not an astronaut. That's, like, too dangerous. I'm going to be the guy controlling the astronauts. If anyone's an astronaut, it's going to be my brother.
All work and only occasional play does not make Jake a dull boy. What do you do for fun?
When it isn't anything academic?
No, I mean beyond the academics.
Does looking up space articles online count? Pi a cubed divided.
He has a full scholarship at the joint Indiana University-Purdue campus in Indianapolis, where he is an honors student in math and physics. He may not be the tallest student on campus, but is surely among the brightest. He regularly gets the highest grades in his classes.
What happens if you have C sub n, where it's proportional to n?
Jake's been auditing classes here since the ripe old age of 8, when it became obvious to his parents that 3rd grade was not going to be enough for him. What did your fellow students make of it?
Everyone was thinking that Mom was taking the class and she couldn't find a babysitter.
The students thought I was the student.
His parents, Christine and Michael Barnett, expected their son would quietly listen and learn. But even they were shocked when Jake jumped right into scientific discussions.
The professor would ask questions and Jake was answering them. And then he took the final at the end and got an A on it. And suddenly the people at the university took notice of that and eventually invited him to attend the university.
It's pretty shocking when an 8-year-old aces a university astronomy course. Weren't you impressed?
I guess I was impressed. I was just doing what I like to do.
No one could have predicted that Jake would even make it to college. Just before his second birthday, he began to regress, stopped speaking and making eye contact. After consulting with several doctors, the diagnosis was autism.
We went through speech therapy, physical therapy, developmental therapy, occupational therapy. A therapist came to the home.
He was going further and further from our world into a world of his own. And I really was just baffled at how we were going to get him back out of that world.
And how did you get him back out of that world?
We realized that Jacob was not happy unless he was doing something he loved.
Which even as a 3-year-old was math and science. His parents say the more he focused on the subjects he loved, the more he began to communicate.
You could just see him just relax. You could just see him feel like, thank goodness we're not working on something that I can't do today.
And how long did it take for him to, as you say, come back?
By the time he was kindergarten age, 5, 6, he was still behind as far as speaking with others and socializing with others. But he was also light years ahead of everybody else. He was coming home asking us, when am I going to learn something at school today? I want to learn algebra.
It was trying to keep Jake challenged that led to a kind of double life. Elementary school by day and sitting in on college courses in the evening. By 5th grade, he dropped out of public school, and just to demonstrate that he was ready for college, he taught himself all of high school math in just 2 weeks. He was 10 years old.
That was the most determined thing I've ever seen anybody do. He had to sit in a calculus class to prove to the university that he could sit still. And Jacob was like, I'm going to participate in that class discussion. So if I need to learn Algebra 1, Algebra 2, Geometry, Trig, that's what I'm going to do. And he took a stack of books and he sat down and he just
Went and taught himself all of it in 2 weeks.
Not only that, he finished the entire state of Indiana curriculum for grades 6 to 12 in little over a year. The Barnetts, who've started a center for autistic kids called Jacob's Place, say that many of Jake's symptoms of autism have disappeared.
There's certain traits that are still there, and if you really, really knew what you were looking for, you could dig them out. But otherwise, that I got a 10-year-old kid at that point in time that just happens to be doing next level work and no one knew anything different.
Your parents told us that you're very proud of your autism.
That, I believe, is the reason why I am in college and I am so successful. It is the rise as to my love for math and science and astronomy, and it's the reason why I care. Otherwise, I wouldn't have gotten this far.
Joanne Ruthseth, a psychology professor at Ohio State, has been studying child prodigies for the last 13 years. She believes there's a link between autism and prodigies.
We know that child prodigies are having autistic relatives at a very high clip, and some of them have autism themselves.
She believes that what sets a prodigy with autism apart from other children with the condition is the prodigy's genes have been modified so that the genius emerges without many of the severe disabilities associated with autism.
In the general population of autism, 10% will have an autistic savant skill where they're exceptional at something. And they've only got that piece displaying itself.
She says for prodigies, be it in math, music, or art, the key to the extraordinary talent is extraordinary memory.
They all share this incredible memory, each and every one of them.
In Jake's case, he's 13 years old. What's remarkable is not just his memory, but his vocabulary is so adult.
Of course, they speak like adults. They've picked up so much information along the way so early in their life and continue to do so.
She says a talent like Jake's is about 1 in 10 million.
Jake's extraordinary. He's picking up information at a rate that none of us could even imagine doing it.
She's tested Jake and says he literally aces every intelligence and memory test.
Imagine if everything you saw you could remember. Every word you heard, you could recall that. And then you could integrate that information and come up with new ideas. That's what he's doing.
Kentucky, New Mexico,
A demonstration.
Nevada,
Dr. Roussette's named 28 states in random order.
Pennsylvania, Wisconsin,
No surprise, he
North
was able to
Dakota,
do it forwards
Washington,
and backwards in sequence with
Missouri,
ease. And when asked again 3 months later, you still remember them
Yes, I do.
in the same order?
And I can still go backwards.
And backwards? Give me 5 or 10.
Kentucky, New Mexico, Nevada, Florida, Pennsylvania, Wisconsin, North Dakota, Washington, Missouri, Texas, Utah, Colorado.
While some may dismiss Jake's talent as simply a gift of remarkable memory, his physics professor says the boy is much more than a human calculator. Is it just great memory or something else?
It is definitely something else. The great memory does help him, of course, because once he reads something, he remembers it. But what is more important is that he has the drive to learn more. He definitely stands out as a powerhouse of raw talent.
Professor Yogesh Joglekar oversaw Jake's research project. Their work was published in Physical Review A. Jake is the youngest person to be published in that prestigious physics journal.
The whole randomness thing, that's like completely against all of physics.
He plans to continue his research, building on Einstein's theory of relativity. His parents say he takes on these challenges with an easy grace.
He has his own little tight-knit group of friends that he hangs out with, he studies with. He leads study groups. I have college-age girls calling the house wanting to know if Jake is available to study during finals. When I go to campus with him, it's like I'm walking around with Elvis.
So far, the king seems to keep his celebrity status in check, more or less.
Practically everyone knows who I am.
Are you a star on this campus?
Big man on campus. I just figured it out.
But the little big man says he enjoys nothing more than using his talent to help fellow classmates see the beauty he sees in the numbers.
Thanks, Jake.
You're welcome. I kind of want to try to use that to end the whole math phobia thing.
Because so many people like me and millions of others are scared of math, are scared of science, correct? Why is that so funny? Well, you almost can't understand how anyone could be.
Exactly, yeah.
Jake is writing a book to help us overcome our fear of math, and he's on track to graduate at age 14, when he hopes to begin his PhD studies.
Kind of a cool kid, right? And evidently he did a TEDx talk, so if you want to see more. Okay, so I want to talk just a little bit about treatment. So, as we said in the very beginning, autism is a neurodevelopmental disorder, so it's not something that we can really cure. We can work with it to help people sort of function at whatever sort of their best level is, to live a life that's happy, that meets basic needs. And so this is a very different treatment approach than perhaps a child who has depression, which is an episode. You have a sort of regular mood, you become depressed, we treat you, you feel better, and then you go on and you stop treatment. So when a child is identified with autism, and this is sort of best case scenario, this does not happen in a lot of places. It doesn't always happen here, actually, in our rural community. But the important members of the treatment team are family and parents or guardians, school staff, having behavioral specialists, occupational therapists, speech therapists, having a pediatrician involved who understands the potential medical needs of kids with autism. Occasionally having a child psychiatrist involved can be helpful. Having an individual therapist. Respite providers can be very important. If you could imagine the video that I first showed you of Allison, that mom probably would really appreciate being able to have a break where she knew her child was safe and well cared for, so that then she could come back and feel refreshed and ready to go again. Some kids need medical specialists involved. Neurology is frequently involved to manage seizures. Genetics, if there's a concern for genetic disorder or if more genetic testing is required. Gastroenterology, and occasionally cardiology. In terms of treatment, applied behavioral analysis is a fairly widely accepted intervention that actually health insurance companies are now paying for, and there are people who are getting specialized training in ABA therapy. Picture exchange systems, so for kids who do better by seeing what they're supposed to do rather than using verbal interchange, that can be a very helpful way. Behavioral management in general, knowing how to help shape behavior for the behaviors you want and help decrease negative behaviors. Joint attention therapy, you may have seen video of therapists who sit with kids and will look at something and try to help a kid see this, and if they actually say it or look at it, then they get rewarded, and this is a very sort of intensive therapy. Having comprehensive medical care, particularly thinking about dental care, overall well care, and this can be complicated if you have a kid who doesn't like to go to the doctor's office, doesn't like to be touched. This has to be thought through, and you can't necessarily go just anywhere to have your child cared for. Earlier intervention can be really important, and then school-based programs. And I see that my next slide is missing. Oh, no, it's there. It just wasn't showing up in my preview. Occupational therapy, physical therapy, speech-language therapy, all of that is very important and happens a lot at school settings, but can also happen in people's homes. Nutritional therapy sometimes is important, making sure kids get enough nutrition. Parent education is crucial to support parents and make sure they understand what's happening for their child, what strengths their child has, and what areas are vulnerabilities or weaknesses for their child. I also think that workshops for siblings, they're called sib shops, are really helpful because often siblings are either asked to care for kids with, their sibling with autism, or feel like they're marginalized because siblings with autism often need a lot of attention. And having a setting where they can go and meet with other kids who have siblings with autism and talk about that experience and sort of have a more typical experience with kids their age, because at home they're not having a typical experience usually. And then social skills training is very important. So in terms of medication, there is a very, very limited role for psychiatric medication for kids with autism. And it's very clear that we're not actually treating the disorder as a whole. What we're doing is treating some symptoms to help kids function better. So, for example, if you treat ADHD, I have a 5-year-old patient with autism who was so active that he couldn't do any learning. And we have very carefully treated his ADHD, and we've been able to slow him down enough so that he's still himself but able to learn, and it's made a tremendous impact on actually his verbal abilities. He's speaking significantly more than we would have anticipated with medication. Anxiety and depression absolutely happen in autism. OCD, as I said, happens, and we try to treat it, although I would say in general we're less successful because it is such a cardinal feature of the disorder. Irritability, agitation, aggression. So the FDA recently approved, or not so recently, in the last couple of years, approved the use of a certain medication, antipsychotic it's called, to help specifically with irritability and aggression associated with autism. And for some kids who are automatically aggressive when they're fearful or when they're overwhelmed or there's just stimuli that feels aversive to them, it can increase their functionality. It's a big deal using these medications, though. Often it means that they need to have laboratory testing to make sure that it's not affecting metabolic systems. Frequently, we have to watch for excessive weight gain and other kind of negative effects. So careful use of medication with kids with autism is really important. And part of that happens if parents are well educated as to what autism is, because then their expectations of what we're treating are appropriate to the disorder, and we're not treating with excessive medication, which just isn't good for anybody. So, okay, so in summary, so autism is a neurodevelopmental disorder. I hope you guys understand the areas of deficit in terms of social, emotional, communication, and then the repetitive restricted interests. And the treatment really involves good coordination with the team and is very much less about medication than really any of the other psychiatric illnesses that I treat. So here's the book with its correct title. And if you have not read it, I really want to encourage you to read it. If you're interested in autism, I feel like this author conveys the experience in a very respectful way, and it feels pretty close to what somebody's experience with autism might be. It is done in a way that we who understand idiom and metaphor, we appreciate that. That's certainly in there, but I think it's pretty true to this idea of what a person's experience with autism might be. And it sounds like the theater experience is really excellent with it. So I really want to encourage folks to watch that or read it. So we have time for questions and comments and thoughts. I also have one more video that's a little bit longer. So, and we don't necessarily have to watch it, but I wanted to offer it. It is of a young adult, I think he's 19, living at home, who is certainly less functional than the boy we just saw, but more verbal than Allison. So that is an option if we as a group want to watch that. So, but first I'll take questions if anybody has them. Okay.
About 100.
100, okay.
Let's start with Allison. Where is she on the spectrum? My impression is it's on a pretty extreme end.
Do I speak in this? Okay, so I've been asked to summarize a question. So in terms of Allison, where is she on the spectrum? She is in the kind of the extreme end of not very verbal, although she's only 5, so potentially she could be a little bit more verbal. However, her mom speaks to her having a low cognitive level, so she likely has some degree of intellectual disability or what used to be known as mental retardation. So her prognosis in terms of functioning independently, it's hard to know at 5, but they're working really hard to just get her dressed. So it may be that she's going to need a lot of support and supervision throughout her life.
What percentage of children on the spectrum would she represent?
So the percentage that she would represent on the spectrum, I'm not sure of the number. I'm really terrible at remembering numbers, unlike our other friend. But not a huge percentage. So there's no more kids are less functional. You know, you can't, that distribution isn't necessarily there.
That's only two, but I'm with somebody else.
Okay.
And if nobody else says some, I'll come back.
Yes.
I don't know if you could respond to this, but it seems, well, because there's such a larger incidence of it now, is our society as a whole prepared to take care of these children as they get older in life? I mean, it's a huge, huge amount of caring and teamwork. My grandnephew is autistic, and I see how many people he has working with him. How can our country support these children? What's going to happen?
Okay, I'm going to try to summarize that. That's an excellent question. So, given the increase in incidence, are we as a society prepared to provide the services that these kids require? So I don't know the answer to that. I am concerned that my patients aren't getting services now. The school is challenged at times to meet the needs of the spectrum of autistic kids. I think that some schools are really good with kids who are less functioning. Some kids, you know, who are gifted can find a spot. But the range is so broad that schools are challenged to do a good job. There are programs now that are certifying for ABA, but you know, those people aren't necessarily moving to rural states. They're in New York and Boston and LA, and we're slowly getting some here. I know that there's a physical therapist who goes to MEMS and other schools, but my impression is that person travels from school to school. There's not one assigned person. So I'm concerned, and the people that then carry the brunt of it are families. And in some ways that's great. You want kids to be cared for and loved for, you know, with their family members. But as you could just even see watching 4 minutes of Allison screaming, I don't know about you, but I was feeling horrible about it. And, you know, I think that can be really challenging. And a lot of times people do it in isolation. We hide from other people in our community that's our experience because it's so outside the range of normal. So, yeah.
When we moved here in '92, there was a boy in our son's class in 4th grade, and I gathered he had autism, and he had an 8 in the classroom, and it was fairly severe. And I gathered there was a move to really mainstream a lot of children, which they hadn't done in the past. And where there's really a severe disability like that, I wondered about whether that's good, because as you said, they're not really getting the full benefit of things, and it's also very disruptive to all the other children in the class.
So is your question about what about mainstreaming?
Yeah.
So, you know, I want to plead, I'm not an educator, so I don't feel like I have enough of a background. And Dr. Bassell, who is the head of Maple Street, was here, and my guess is she would have some very interesting things to say. In Salt Lake City, where I trained, there was a special school for kids with autism, and the kids who went there did great because every staff person understood and cared about autism. There were actually families who moved to Salt Lake to send their kids there. So there can be a value for having an expertise. However, I think the caveat is that in the past, sometimes it was warehousing. And so wasn't there a school here in Bennington, or not Bennington, in Vermont, that was sort of a warehousing of people with developmental disabilities or intellectual disabilities that was closed recently? Does that ring a bell for anybody?
Yes, I can't remember either, but I think it was, yes, there was a school.
Maybe. And, you know, there are questions about, you know, whether kids are just left there or whether they're really pushed to be educated and grow and, be who they really can be.
There was a school where the town hall, Manchester Town Hall, was, I can't think the name,
Mount
it was a
Laurel.
woman's name.
Mount Laurel School.
Is it? I'm not sure, but it was for kids with developmental disabilities. When it was started, we called them, retarded kids.
Yep.
That's where the town hall is now. That building was built for
Huh.
for that, and then it was, I don't know whether the funding was cut and the kids were mainstreamed.
Wow.
And I'm sure some of it was autism, and everything else, all. Sorry.
I'm going to repeat that on the mic just so that the TV audience can get that. Just that at one time in Manchester, where Town Hall is now, there used to be a special school for kids then who are known as mentally retarded and maybe autistic as well, but it's now gone. Okay. Great. Other? Yeah.
I would speak to your question about inclusion. I have a 20-year-old on the spectrum, and he's progressed through the public school system here in this town. In fact, my son went through the school system with Gloria's daughter. And for us, inclusion was only able to be effective through just about the 5th grade, when it became clear that, I guess the way we look at it, and I would love to see the public look at it, is inclusion is a feeling, it's not a place. And if you could use that as a marker to see how your child is receiving his education and his authentic experience in sharing life with others, not simply in academics. And if you get to a place where they're spending all their time trying to manage their behavior so that the other students can learn undisrupted, that's not healthy for anyone. And inclusion breaks down by a formal definition at that point. And so we were much more successful than transitioning and having students come in and share an authentic experience with him one-on-one as he progressed. And his classmates loved him and continue to love him. And I think it's because there was so much mutual reciprocity of respect. He wasn't a deterrent for their ability to progress, and then they didn't become a deterrent for his. So inclusion is a feeling, it's not a place.
I'm going to repeat that too. Inclusion is a feeling, not a place. Is there anything you would want to say, given that you have an experience of a child with autism, that I've forgotten or that you feel is really important?
One piece that has worked well, at least for us in our family, is a type of intervention strategy called a relationship development intervention. It's almost diametrically opposed to ABA, but I think with autism, the way I have learned to embrace it and love it and see the cherished part of it as much as the challenge is that it's all about what we would say is authentic experience sharing. And you're trying to tap into this child's ability to authentically share an experience with you. And there are pieces, as your presentation, I think, puts it in such a clear and accurate way. There are pieces that get in the way of that, and you have to find that path. But for me, it's about the success in helping a child with autism progress is the ability to increase their dynamic intelligence, their mental flexibility. It hasn't served us any use to script or to tap into that wonderful memory, that procedural memory that they all have. For us, it's really more about being able to flexibly recognize that they have within them an ability to cope and see changes, recognize patterns in life, start simple and small, but recognize if I can see the pattern, then I can see when the variation and the change occurs, because that's what life is. Life is dynamic, and it's never the same twice, and it's messy, and they need to be prepared if they're going to be able to have an authentic quality of life, and if all of the people around them who love them aren't destined to lead an autistic life to keep their status quo, then we have to embrace the messiness, and we have to have high courage and a huge sense of humor. But to me, it's dynamic intelligence. That's where the focus should be. It's not about making my child or your child or anyone's child perform in a socially appropriate way, to call that success for the sake of success. It's can you manage life, the change that occurs, gracefully and fluidly, and recognize that I take my memories, which are just passive, right? Memories are just passive until you can encode them, draw them up again, and apply them in the future for better decision making. Then it becomes knowledge. And when you get that point, when you hit those little pieces with your child, where they draw upon a past experience and on their own, through your help, are able to apply that to a future situation for a better outcome, that's life. That's dynamic intelligence. And then you know you're making authentic progress.
Thank you so much for saying
Sorry,
that.
that's a little long-winded.
No, that's
As you
wonderful.
can tell, it's a labor of love.
I think it's so important that we hear, like, the people who are doing it every day and have thought about it in a really deep way. So thank you. We'll do you first, and then we'll go to Barbara.
Well, I just want to amplify or build on what, I'm sorry, I don't know your name, but
Lori,
what Lori said. I have a somewhat, perhaps unusual relationship with autism, in that I teach adaptive skiing at a camp, one of the Paul Newman camps for challenged children. And about a third of our students are somewhere on the spectrum. Okay. And this place is totally amazing. You know, you walk into that room and there might be 50 kids in there, plus adults, and all of them, every one of them is typical. There are no atypical kids, whether they got arms or legs or they're spinning around or whatever, they're all typical. And one of the things we try to do as instructors is find out what they like and what they can do, and then build on that. And that really resonated with me with the picture of Jake. In that, hey, you didn't try to make him something else. You found out what he was good at, and then let him build on it. And that seems to be a very important aspect of working with these kids.
Isn't it an important aspect of working with all of us?
Yes, that's true.
But especially, right? Yeah, and you want kids to have success and feel like they're good at something. Yeah, that's great that you do that.
Yeah, most of them become pretty darn good skiers.
I bet. Barbara.
Do you know if anyone has done a study on how many successful people, famous people, may have had like Asperger's or something? Anybody studied that at all?
So has anybody done a study on famous people with Asperger's or? So I don't know that they have, or at least they haven't published it. In psychiatry, certainly we all wonder about certain people. You wonder about Bill Gates, Steve Jobs. Like there's certainly some folks that. And I had the person, my psychiatry professor who did the ADOS. I really thought she had Asperger's. She was very good at it all, and but I don't think there's actually an official study of that. Yes.
Just quick, we had a great example of somebody with Jake's kind of memory ability here this summer, and over at SVAC they had a man who is alleged to be the world's expert in ragtime and so on. And he claims that he remembers every note of music that he's ever heard.
Yep.
And And I mean, that's just mind-boggling to some of us who can't remember how to sing Happy Birthday sometimes.
And his brain is actually even more unique because not only does he remember, but he has multiple scores going at the same time in his brain. And they were able to look at a CAT scan or a PET scan and watch that happen. And I mean, he has a really unique brain. Yeah, I saw that too. It was amazing. And who knows, you know, maybe he's on the spectrum. He did great getting up there and performing. So, any other?
He also did say that he had a lot of problems as a younger person.
Yeah.
It wasn't until he found a skill that he could build on and that people appreciated that he could star at, that then he became like Jake.
Yeah.
You know, to be more or less, quote unquote, normal.
Yep, that's right. So one caveat about kids sort of following what they're interested in is what I found is that a lot of my patients are interested in video games and they disappear into them. And so I think we have to be really careful about electronics and video, and it provides a terrific escape for kids, and they certainly, it speaks to some needs to them about controlling an environment and stimuli and all of that. But I've also had a lot of kids who the police are called when you ask them to turn off whatever they're doing. So, you know, as a society, we're learning how to manage that kind of thing. So, any other questions? Okay, I'm getting the time sign. So thank you so much.